Well, pregnancy is a physiological process as much as it is a psychological and hormonal and emotional process.
I had no idea that pregnancy would affect my mental health. There was no thinking around that. Although, when I was pregnant, there was so much, it was an immediate spike, trigger, all of that. Immediately. But I still wasn't having those conversations.
Welcome to Season 2 of Students of Mind, the podcast where we aim to normalize conversations about mental health. Last season, we connected you with experts in the field of mental health to provide an understanding of topics and illnesses that may not have been easily accessible. This season, we will continue our learning journey together by not only speaking to experts, but also by listening to the voices and stories of real people who are living, surviving, and even thriving, while also facing challenges with their mental health in their everyday life. This season, we want to hear your stories to get the full truth of what it's like to manage one's mental health and navigate living with mental illness. My name is Jade, and this week we're focusing on maternal mental health. With me to discuss this topic and give some insight into the current state of maternal mental health in the U.S. is Dr. Sayida Peprah. I also will be joined by Yhanni James, a mom, model, and entrepreneur, to talk about her pregnancy and birthing experience and the mental health implications that followed. I hope by listening to the show, you're able to learn something new and gain some encouragement through hearing our experts and listening to the journeys of our guests. However, this show is not a substitute for professional advice, diagnosis, or treatment. Always seek the advice of your mental health professional or other qualified health provider with any questions you may have about your condition. Never disregard professional advice or delay in seeking it because of something you have heard on the Students of Mind podcast. Today's first guest is Dr. Sayida Peprah. Dr. Sayida is a licensed clinical psychologist and birth doula with a focus on multicultural psychology, trauma, suicide prevention, and maternal mental health. In order to expand her knowledge, Dr. Sayida has traveled all over the globe to learn about indigenous culture and spiritual tradition, as well as different approaches to treating mental health issues. Dr. Sayida is the founder of Diversity Uplifts, which is a nonprofit that trains providers in cultural competence. In our discussion, we talk about the changes expecting mothers go through during pregnancy, the ways pregnancy and the birthing process affects mental health, and the current state of Black maternal mental health in the U.S. So welcome. Thank you so much for being here today.
Thank you for having me.
So before we get into the topic of today, can you tell us about yourself and the work that you do?
Sure. I am a licensed clinical psychologist by trade. I'm also a doula. I'm a community doula coordinator as well, and I do a lot of education and advocacy for community-based doulas. My background as a psychologist was a lot in very acute and chronic mental illness. I worked in psychiatric hospitals for a number of years. I worked in the prison system for over 6 years, working with incarcerated women and men and transgender folks. I have since kind of stepping out of working sort of in organizations. I worked in community-based mental health services. Some of them served homeless populations and transitional homes and sort of various direct services. I've come a bit out of direct service over the past couple years as I've seen a real need in education and training and really creating some cultural competency among providers that work with all the populations that I've worked with over the years in a very practical way, bringing the information straight from the community and like more direct needs and perspectives and the community-based perspective into sort of organizational and systemic structures, but also direct providers. So a lot of direct providers consult with me as well. I run a nonprofit now called Diversity Uplifts, where I primarily do a lot of that work to create opportunities for organizations and providers that work with the community to have more cultural competency. And when I think of cultural competency, I think of it also as, really competency around working at an intersectional level, looking at reproductive justice when you're in maternal and perinatal services, and not just sort of classic health systems. For the mental health world, looking at race and gender and sexual orientation and religious practices and cultural identities, philosophical perspectives, really being able to include abilities, disabilities, like thinking about the whole person and all that impacts them and all that interacts with the way that you interact with them. And so I do a lot of implicit bias training and historical narratives and perspectives for providers, because I also feel like it's really important to have a sense of what whole communities have experienced, not just the individuals that people are working with. So I do a lot. All that to say.
Yeah, I was going to say, it sounds like a lot. And my next question was, so you said that you are a doula as well. So where did you become a doula first, or did you do your psychologist work first?
Well, I feel like both of them were sort of natural callings to me to be, like this sort of therapeutic helper, listener, um, you know, consultant on life issues person. I feel like I was that for my friends growing up and, for family as things came up. And I had a friend as a child who had a baby when we were in high school. And I was unofficially, but practically speaking, the doula for her birth, and really supported a lot during her pregnancy and with her daughter, who is my goddaughter. And I was always very interested in pregnancy and breastfeeding. It was something that I don't remember not being interested in. And so when I had my own child about 14 years ago or 13 years ago, I realized that there was a role called a doula, that there was a profession or a practice out there, and then found my own doula who supported me. And after that, I was like, this is like my calling. I have to be a doula. I want to do all the training and just go to all the conferences and know everything about it. And so I took my journey in that and started practicing, really actively. Back in 2000, between 2008 and 2010 is when I really had started, and then on from there. But I was also in graduate school for psychology at that time. And so I was simultaneously getting, doula training and, coming into the birth world, and also being trained as a clinical psychologist with a multicultural community background. And while, like literally had births, at the same time that I was in internships and working in hospitals. And those passions have continued to be a cornerstone of the work that I do in the world, and sort of the way that I present. I consider them to be like my own ministry in a lot of ways. And now I do a lot more integrating those topics for both of the fields. So I got into a lot of the public speaking that I do now because I was a clinical psychologist that knew a lot about birth. And so my colleagues in mental health were like, what's this whole birth thing? And, what about this? And, what about maternal mental health? Because interestingly speaking, most therapists don't get trained in maternal mental health. They only get trained in sort of classic mental health, for quote unquote general populations, even though women are at least 50% of the population. And a good amount of women have birth experiences or pregnancies. And, but my colleagues didn't know about that. So I did a lot of talks about birth for the mental health world. And then in the birth world, people wanted to know about mental health. And so I started also doing a lot of talks for the birth world about mental health and trauma and, historical perspectives. And now it's fused into this sort of perspective that a lot of people share now, the need to have the fusion between conversations of mental health and maternal health. But it wasn't like that when I first started.
Yeah, that's just really interesting how you were able to kind of do both of those things at the same time, and now your work centers around those two things being together. Can you talk about what a doula is? I feel like some people may not know what a doula is, and like the role and responsibility that doulas play during birth, before birth, and after birth.
Absolutely. So a doula, is a term that was coined a number of years back when that sort of profession came into the current version of it in the United States and in Europe. People also call themselves birth workers or perinatal support people, but basically a doula or perinatal support person is an individual, typically a woman, but there are male doulas out there and non-binary folks that are out there who practice, I would say the art, both for me, is spiritual, emotional, and also physical aspects of caring for and supporting a pregnant, laboring, and or postpartum person. And so there are birth doulas who primarily focus on being present at the actual birth, providing physical and emotional support techniques, typically meeting with clients before and after, before doing childbirth education, training and conversations around, the future lactation process. And then once the baby's born, being there for the birth. And then afterward, sort of, I think of it as tucking them in, making sure that they get, a good start with breastfeeding and as they go on in their journey. Postpartum doulas really focus on the postpartum experience, which is an after the baby's born, coming to the home and supporting the birthing person and caring for their baby, and then understanding how to care for their own baby. So they're not necessarily like a baby nanny, right? So they're not there just to take care of the baby. They're really there to take care of the new mother or the birthing person. But sometimes that does look like giving that person ability to sleep. And so therefore they're taking care of the baby, but then they're also helping facilitate breastfeeding and lactation support and things like that. Cooking can be a part of that, light cleaning, but typically it's not meant to be the role of like a housekeeper or nanny. And I'm saying that because a lot of people don't understand. And when I talk to my postpartum doulas, that tends to be a thing that they have to sort of clarify for folks. So they're really there just for them to adjust as a new parent and not to do these extraneous things. But some postpartum doulas, work in various scopes of practice. There's something also called a full spectrum doula, where doulas are really trained to support the full reproductive experience of a person. And so that is, supporting with abortion, supporting, and not as in providing abortions, but providing support, in that process or after that process, with stillbirths, with perinatal loss and grief, with miscarriages, with, folks that have, even in the postpartum experience, making sure that they have access to resources that are a lot more community-based and sort of holistic speaking. So typically a full spectrum doula and or community doula will also be connected to maternal mental health services and things that are going to support the birthing person as a total person and not just isolated to the birth or isolated to after.
This is really interesting because I guess I'm just wondering, like, how common is it for people to utilize a doula? Mm-hmm. I feel like from how you're talking about it, it's very much like someone just holding space for the individual who's going through the birthing experience. And it definitely seems like this doula is providing some mental health support. And that's interesting to me because just, knowing that doctors sometimes don't have that kind of like mental health competency to be able to support a person who's pregnant. So yeah, is there like mental health competency within being trained to be a doula? And also, how common is it for people to utilize doulas? Because I feel like it's a very helpful and important resource.
Yeah, I agree. I feel like everybody should have a doula if they want one, or at least have access to one. So that question of are doulas, sort of trained in mental health? Not formally speaking, not in the classical doula models, which are, have been, sort of historically in the States, white led organizations that really have come together to create this profession of the doula. And the mental health competency wasn't necessarily a part of those early models in the way that I've seen. But now I think all of the doula models, but particularly the community doula models, the models that are really coming particularly to the Black community, are very aware that the doulas need to have some mental health training because understanding how to manage and help support and mitigate stress and sort of screen for or understand what happens when people get beyond the normal realms of mental health. It's really important for doulas to have a sense of that. So as a psychologist that's also a doula, a lot of the trainings that I do with doulas really does form around providing mental health competency for doulas. It's something that is a mission for me, that I want doulas everywhere to understand how to assess for and support people when mental health issues come up. And we see that, in particular in the Black community and other communities that have, additional life stressors on top of just being, a pregnant person in the world, that's necessary to have that context. And particularly because, if providers, as in physicians and nurses, are the only people that, are sort of available to that, but they're really not available, right? Like you go into your 15-minute doctor visit, you're in the hospital for however long you're there, and then you're gone after 3 days. Who is actually watching, and supporting the mental health of pregnant folks? Like, realistically, nobody's been responsible for that. Nobody has held that space to be intentionally supporting that. And not just thinking about their bodies. Now, the midwives definitely have credit, for within their model, which is very holistic, keeping mental health in mind. And it's why a lot of doulas love to work with midwives when we support families, because their model is very conducive to really supporting the whole person. And so we do see that. So to answer that, I think there needs to be more training. There isn't necessarily as much as there, could be, and we're all out here doing what we can to change that. But it definitely is. I think of a doula as a part of the mental health team as much as I do as a part of the maternal physical health team as well.
Yeah, that definitely seems like it's like a dual role that they play. Mm-hmm. So now can we just talk about mental health and pregnancy and birth in general? So, like, what is it about the birthing experience and pregnancy that cause some of the mental health implications that we see? And why is it so important that pregnant individuals, people who are giving birth, to utilize people like doulas and midwives and other people who can support mental health through birth and pregnancy?
Well, pregnancy is a physiological process as much as it is a psychological and hormonal and emotional process. As soon as you become pregnant, your body starts emitting, hormones and chemicals throughout the system that cue it up to change. And it changes not only, your physical presentation, and certain body parts start, growing, and fat holds in certain places. And, it's queuing up to be able to house this baby that will grow and, bringing nutrients to, before you even realize you're pregnant, your body is hard at work doing a lot of things to queue up the process, which is why people get really tired in the beginning. And so the process itself also is changing your chemical and your hormonal makeup. And those of us that have menses every month understand that the change in hormones that has a physical result of, let's say, bleeding every month is a real thing. It's not a conceptual thing. It's not like a woo-woo science or witchcraft. It's like you have actual hormones that are actually changing, and it actually affects you, and it affects people differently. And just like there are some women who are like, oh, I don't even know when my periods come. I don't have mood swings. It's not a big deal. But most people are like, yeah, I can definitely tell something's changing. I'm a little bit more sensitive in certain ways. But then there are other people who full out shut all the way down, and they're exhausted, and they feel really strong, like depressive symptom, or they feel really strong anxiety. I tend to be on the more anxious side of things. And so I start noticing that I must be getting close to my time, because I have really intrusive thoughts and worry about things that were yesterday fine. And I'm just like, yeah, I know this is something to think about, but why do I feel like the whole world's going to end? Like I've learned, as I've gotten older, to really have perspective that when I feel this extreme anxiety in its moment, it really is like a short-term shift or a very quick shift in my sort of emotional state. I become curious about it rather than becoming distressed, because I understand. And so in that same way, I think it's really important to think of pregnancy also as like it affects this person. It's going to affect their body, which also is practically emotionally shifting. So if your body becomes tired because it's working really hard, but you don't know that your body is tired and you just feel exhausted, but then you also have work to do and you have people that are demanding, you can feel really overwhelmed, right? And so then that becomes a mental health situation. And it doesn't mean you're have a mental health disorder, but it becomes something that's really emotional, psychological, reality that needs some consideration and some understanding. And so you also have, during the birthing process, obviously, really strong changes in hormones to move the baby out. But that really remains, contained within this period of time when you're in labor and you're pretty much that's all you're doing at that time. And then as soon as that's over, when the placenta, separates from the body, the hormone shifts are more drastic than anyone will ever experience in their life. And for some people, it can, start, a trajectory of imbalance that people are not able, their bodies, their minds, their chemicals are not able to sort of catch itself back into balance and normalcy easy. And so then it feels really distressing and people can have really strong emotions, really strong sadness. And a bit of that we call baby blues, where we expect to see this like emotional variability in these first couple days and the first couple weeks. But then by 3 weeks, which is also around when you stop bleeding, and basically that whole process of the physical aspect of it is sort of phasing out. You should resolve that kind of fluctuation in mood. And some people don't. And when they don't, then we're looking at, sort of a more chronic potential, perinatal mood or anxiety disorder, which is like classically, people think of like postpartum depression, but also can be anxiety and other things. And then I think on a more practical level, outside of the physical reality, a lot is changing. You're going to have another human come into your life. People may have not planned for the pregnancy, or they planned and then they realize, whoa, this is going to be way more than I thought. Or unexpected things happen in the course of the 9 to 10 months when you're pregnant that also cause you to have to figure out how to manage something you hadn't managed before. And so just like when people move or when people go to a different school or people change careers, we expect to see mental health be challenged sometimes because it could be stressful to have this kind of change. And so on a practical level, there's a lot of adjustment. And anytime you have to have that much adjustment, you're looking at the need to support someone, emotionally, physically, psychologically. And so pregnancy has a lovely medley of all of those things happening at the same time.
Yeah, it sounds like a lot.
Not to scare you.
Yeah. Yeah, but I think just a side note, my mom was a lactation consultant and did a lot of went to a lot of breastfeeding conferences. So I grew up being around doulas and midwives.
Exactly.
So I just was able to kind of like witness what that whole process is like and how the relationship between like mom and midwife and mom and doula are,
and you see how
so
supportive
sacred.
it is too. Yeah.
Yeah.
I mean, it's a game changer. So if you do that whole process by yourself with no information about what's happening to your body and to which stage of the process is coming next, and then when you get there, you don't know what to do, it can be distressing. And that's really what I see as the issue, particularly in the Black community, is, this too many stressors on this person who should otherwise just be able to be pregnant and to labor and to give birth and then breastfeed or nourish their baby and just have time for that. But we have a very stressful, non-supportive, industrialized, capitalistic, patriarchal system that is still going to run you into the ground until the day you pop that baby out. And as soon as you're done, when you're coming back and how quickly we work you and all these pressures. And so, the midwife, the lactation consultant, the doula, they understand that, and they are like a buffer to that. They're like helping you understand, okay, so in this next stage, you're going to need to have preparation for this. So who's going to come by and make sure you have foods because you're going to be really tired and you're just going to need to take care of this baby. Let's make sure you have, nutrition. If you don't have a plan, you're malnourished, you're hungry, you're frustrated, you have lost lots of sleep and lots of blood. And I mean, who would expect anybody to fare well with that? So I don't think of maternal mental health in the United States in general, but particularly in the Black community, as a fault of the individual. It's really a systemic problem that we have that sets up people in a way where they really can't catch themselves. They can't balance themselves out the way they should be able to. And that's why I love to have these protective and supportive people in there in the mix, because without them, the system is coming for you. I mean, they're like looking for you as soon as you get out to hustle you and work you. And then of course, that within culture, strong Black women syndrome dynamic that we have in the community around being independent and handling business. And it's amazing. And we have such fortitude and resilience, and, you give us anything, we're going to make it work, but we need to rest. And birthing and nursing and this time for, becoming mothers and parenting really needs support. And it's what we need the most, to me, in the community these days.
I definitely want to talk more about that, just like the state of Black maternal mental health in the US right now. But before we get to that, I wanted to ask about just like risk factors. This obviously is a very vulnerable time for the person who's pregnant. But I'm wondering if there are some people who will have like more severe mental health implications than other people, due to like pre-existing conditions, environmental factors, or anything else. Like, are there things that make some people more susceptible to these implications than others?
Yes, there are definitely risk factors. So one of them that you said is people who've had a history of mental health challenges before, and that really is just an indication that there is a vulnerability to distress for a lot of different reasons. They could have had historical and personal traumas that have affected them to a level where when another stressor comes up, it's not like it's not hitting a freshly balanced fully strong individual, but someone who's already been compromised emotionally, and so it can be difficult. But also that also can tell you if people have a history of depression or anxiety or bipolar disorder, that they have potentially a history of chemical imbalance, which can be exacerbated by another opportunity to have a chemical imbalance, which sometimes pregnancy or the postpartum period can induce. And so between the stresses that are added on to the scenario of pregnancy and having a new baby, and just also the physical changes that can take people over. And so they become, and I like to talk to people, especially when I'm talking to clients directly. I don't want them to think like, oh, I'm high risk for this. Like maybe when I'm talking to providers, I have that conversation, but I want them to be thinking, where may I need more support for myself? Just like if you're doing like a health assessment, right? Like, you do your blood work and, you get your blood pressure and all that stuff. And they say, your blood pressure is not terrible, but it's not like amazing. Like you need to watch that, or you need to minimize your sugars, right? Like it's helpful to have a self-assessment about where am I starting at, right? And so then you make sure you have the supports and not really become anxious about it, but keep, all the wellness things in place. If people have had previous postpartum depression or any kind of perinatal related, they can potentially have the risk again for having it. Just they have a system that may be vulnerable in that way. If you have lost a baby or have had any perinatal grief, that can be difficult because obviously that induces its own stress and depression potentially, and anxieties. There could have been a lot of unhealed things. So even if they say, oh no, I don't have depression, but I did lose a baby some years back, it can also be something that was unhealed and kind of trigger things when they're in a new pregnancy. Unexpected changes in labor and delivery. So you ended up in a C-section you didn't expect. The labor process was so fast that you were like really feeling unprepared for how quickly it moved forward. People disrespecting you in the childbirth experience and feeling, threatened or, emotionally assaulted or obviously physically assaulted, with, let's say, providers, touching you in ways you didn't want. And I don't mean sexually, but, Black Women Birth and Justice did a Battling Over Birth report back in 2018. And one of the stories, an individual was saying that the nurse was telling her not to push until the doctor came. And so her body was naturally pushing and she felt like she needed to push. And so every time she was having a contraction, and then for those that don't know, you sort of naturally push when you're having a contraction, when it's your pushing stage. It's like diarrhea. Nobody has to tell you, okay, it's time to get it out. Like your body starts contracting. The nurse was hitting her leg every time she was pushing. I said not to push. It's not time to push. Like that kind of like really disrespectful assault. I mean, it's like, who's putting their hands on you, And so those kind of situations can obviously create, a state of trauma that is unresolved and can cause, sort of ongoing mental health. And then obviously, like any kind of real practical life stressors, financial stressors, legal concerns coming up, if immigration is an issue, interpersonal relationships, domestic violence, anything that would in a normal situation cause distress for someone, being pregnant and postpartum can make it even worse.
So you've mentioned maternal depression and postpartum depression while you've been talking. So can you talk about what those are and how they're different than like major depressive disorder? Can you just talk about what distinguishes those?
Well, I mean, one thing that distinguishes it is the timing, so that it is happening as a result or after pregnancy or the postpartum period or during pregnancy. And so you can have a situation where an individual had major depressive disorder, they have depression in their history, and they become pregnant and continue to have depression. And we would, as therapists and clinicians, assess that typically as, a general depression that's sort of been exacerbated by pregnancy versus perinatal mood and anxiety disorder. On a practical level, I think people don't need to try to figure out, which came first, the chicken or the egg. If you have depression, there's a protocol to deal with it and there's support that's needed. But certainly, I think there is a good distinction between sort of circumstantial depression because of the scenarios and the stressors that are happening versus a chemical-based depression. So you could have a situation where your body, because of hormone changes, has gotten out of whack, let's say, where it really then typically necessitates, either medication. Some people do, herbs, but definitely like sort of addressing the chemical imbalance kind of directly, where a lot of people also can recover, with talk therapy and general behavioral practices that are helpful. And so I think that, it can be helpful to understand that some of the depression can be caused directly by hormone changes. That's actually not the circumstance. You have a supportive family, you had a happy birth, everybody came out healthy. And you can't even come up with an idea of why you're so depressed, but you are, right? And so that can also be just a pure physiological situation.
So another question I have just about if someone has a mental illness before becoming pregnant, I think even for me, just thinking about myself, as someone who has multiple mental illnesses and is on psychiatric medication, I think that like mothers to be or people who want to have kids might have fears around what's going to happen when I get pregnant. Do I need to stop taking meds? Are my meds going to affect my baby? What does treatment look like during pregnancy and after pregnancy? So can you talk a little bit about like managing pre-existing symptoms of mental illness during pregnancy? And I know it's kind of hard to say if, you should stop taking medications, but like, what are the conversations like around medications when someone with mental illness is thinking about or is pregnant and about to have a kid?
This one I think is really important to hear. So I'm happy that you asked it the way that you did. People with a pre-existing condition of mental health challenges, especially who have already been on medication and are currently on medication, you certainly want to queue up just really strong support for the process. And I want everybody to have that. But I really want people who already may feel vulnerable, even just you're feeling like I'm more vulnerable, right? Creates more vulnerability, right? And so I want all those folks to feel really supported and like they have all the people in place that can give them all the information. And if anything happened, they could be cared for, right? So they could just relax about the process and just go into this amazing, process of coming into parenthood with as much ease as possible, like to really do what you can to settle out concerns by having the support people in place. You want to make sure that your medication prescribers, particularly, psychiatrists, or if it's a direct primary care physician, they have special training in perinatal psychiatric prescription. And if they don't, you want to connect them to or make sure they're really queued up to have consultation during your pregnancy and your postpartum period. I was on a committee, maternal suicide committee for California, and basically we reviewed all the cases of women who took their life pregnant or in the postpartum period up to a year. to see what was missed. What were the opportunities? Like, what can we learn about this? And one of the big things that we saw was that there were individuals who had had a history of mental health. They were on medications and they had been taken off medications by providers, or they stopped medications because they were afraid that it would hurt the baby or something like that. And one of the things that we wished is that there were more competent people who are around them when they got pregnant to let them know, no, if your risk of a mental health concern is actually a bigger risk to parenting and to your pregnancy process, of you having really acute distress, having really strong anxiety, having psychiatric episodes, having strong depressive situations. If you have an extremely depressed mother caring for a baby, that is not better than having a baby that was in the womb of a woman that was on medications that mostly would be not concerning. And so on the question of medication, there are definitely medications that every type of mental illness can be treated while you're pregnant and while you're breastfeeding. Some of them do have to change. And with providers that know how to do that, there's protocols for that. And so it's really about getting connected with providers that are the most competent. And unfortunately, just like as a psychologist, most of us weren't trained in maternal mental health. Psychiatrists were not trained in perinatal prescription. And so there are people these days getting specialization, but there are organizations like Postpartum Support International that have a consultation line for providers to make sure that, so you can empower yourself as an individual who has this psychiatrist that you've been with since you were 15 and you love this person and you really don't want to come away from care. You can connect them to the consultation line for free, and they can make sure that they're adjusting medications in a way that supports you the best. And then you have this dual team of people who are, perinatal support focused, and then your psychiatrist who you trust and know, and who also knows your body and knows the way that you have cycled through medications, which is very important. The biggest challenge that I've seen in, records of situations that haven't gone well, but in conversations also with people who have, had good outcomes, is this separation in care, where you had a provider and now suddenly you're switching to another provider who doesn't have a perspective of what you had already been on, and also providers that just may not know how to make the best advice. So yes, you can stay on medication. Sometimes they have to change. Most medications are considered to be safe enough that it's worth maintaining to maintain your mental health. And it's all available. It's just like smokes and mirrors because unfortunately not everybody knows or has information about that. It's not like in the popular culture, but it's really a part of the main conversation now. It's been shifting in the past 5 years for sure. And I think, those that are birthing right now and over the next 10 years are really in a better position, because it's been popularized, these conversations about the need to blend this understanding.
Yeah, I think a lot of people are scared around taking any kind of medication during pregnancy. So, and like you were saying, yeah, I do think there's like the information's there, but accessing it is where the issue is.
Yeah. So again, for access, the best resource, Simple, Perinatal Support International. They have a consultation line for providers, but they also give information to lay people. Maternal Mental Health Now also has a lot of information for folks about managing mental health if they have high risks. And really having those conversations directly with your providers, though, assessing their level of competency with this new change in your life is important. And if you feel like they're not, because they just don't want to lose your business, or they're not really being honest, or you're not really feeling like they're very competent in that, then get additional support, like really reach out, through your insurance or however you're making payments to find people that are specialists. Because, it is, I think if people know that they even have that option, then they're more likely to do it. I think people don't even realize that it's there, and they just think, oh, I have to stop my meds. And so then people don't want to become pregnant, or they want to stop their meds. And then that's not going to be helpful either, because it creates, an immediate challenge. And it also could be very dangerous to come off of medication that you've been on while you're pregnant. Like if you've been on them and now you're also going to change, your chemical makeup as well by doing that. So just doing it under, full advice of providers is the most ideal.
Great. Yeah, I think that could be really helpful for people. So you talked about this a little bit earlier, but can you talk about the state of Black maternal mental health in the U.S. and just like why it is that we, Black mothers tend to be disproportionately affected by everything that comes with birth and pregnancy.
Yeah. Well, I think, when you step outside of just looking at birth and pregnancy and look at general mental health statistics in the Black community as comparison to the white community, we have higher rates, statistically for, depression, in particular anxiety, and mental health and in most aspects. And so why do we see that? Well, we have a really strong historical legacy of trauma and racism and stress to the community, which certain individuals have been able to mitigate, certain families may have been able to mitigate. But as a collective community, people have tended to experience personally the impact of systemic stress and systemic racism, right? And so a very industrialized system that doesn't honor the need for people to rest. And that's all the way, from being enslaved and having ancestors that were enslaved, potential effects of epigenetics with that. And that really is just mostly, particularly around the stress response that, many people's, ancestors would have had to needing to be hypervigilant, needing to be, overly aware of danger and basically anxious to protect themselves from danger, right? And so there's, evidence that, the genes can turn on certain habitual stress responses as a protective way in one generation. And if it's chronic and long-term enough, it can be passed on, through the genes into the next generation, whether or not they have the same stressors. And so, but of course, the opposite of that is that, having, long-term opportunity to have stress reduction techniques and dance and song and yoga and meditation can also cue your body up to, we don't need that anymore. Let's just have a nice Zen, response system. And sometimes things are stressful and then we relax, right? Like, so it's all repairable. It's all, it changes based on, sort of individual factors. But we do have that within the community, this like large scale historical traumas that have occurred in a lot of the community. And so you also have people being raised by people who are extremely stressed out, people with multiple jobs, people even with a single job, but in a high level of leadership, and they're the first Black person there, and everybody's undermining them and everybody's expecting them to fail, or all this pressure to survive so that you can move your family out of poverty or out of, and so a lot of pressures, just a lot of pressures, particularly for the Black mother who is holding up the family in many cases. A good majority of, Black homes being led by single mothers, around 60%, in the last account that I saw, and not that the partners are not somewhere around, but not necessarily as primary and holding down the fort. Like the women are holding it down and people are around doing, whatever aspects that they're playing roles in the family. But to have, a really strong women-led leadership within family, within business, within, we're the highest educated among our ethnic group as women, and so it's definitely a lot of pressures. And so when we look at maternal mental health, we're just looking at another pressure, right? Pregnancy and the postpartum period. And so I'm not surprised when I see that. And I don't think anything more of it except for the reality of the systemic pressure. And in that sense, I don't think, it's not biological. It's not that we as Black people are more likely to have, emotional distress on a physical level. There's nothing, genetically, as in our primary genes, not just what is turned on to be resilient and responsive. So you have your baseline genes, and then you have codes that turn on and off. So some of the genes for, reproduction turn on and off when you get to maturation age. The genes were always there, but they don't necessarily turn on for everyone at the same time, right? Or at all. And that's, sort of the difference between we're looking at epigenetics versus basic genetics, which is that we all have the propensity to do really well in this world and to be really resilient if we're left, with the resources and the opportunity to have that level of ease. And we don't see that in the Black community. We see pretty constant stressors to the Black mother. There are a number of studies that have shown different things. One of them, showed about 44% of Black women having postpartum depression, for example, in comparison to 31% of white women. Depending on where we are looking in New York and California in the South, and, we're going to have different rates, depending on the areas. And so the statistics are not exacting in the sense that they're seeing a particular difference, except that Black women tend to have more perinatal mood and anxiety disorder reporting than white women. What I find interesting about that, though, is it's not necessarily because we're treated with postpartum depression or actually, sort of assessed, but it's more in the focus groups when people are asking questions about what symptoms people had, then they realize Black women over-report symptomology that is related to perinatal mood and anxiety disorders, but not necessarily treated for them, not necessarily assessed for them, not necessarily given the support that they would have needed, which is also a concern because if you have, a disparity there, but also you have an undertreatment of the community, do we really have a disparity or do we just not have support? Do we, is it just, it's so not culturally normalized and, societally normalized to think of Black women as needing care in that way. I've heard in a number of, Black groups, people are like, oh, postpartum depression. That's like a white woman's thing. We don't have time for postpartum depression. I mean, nobody's sitting in bed saying, oh my gosh, I can't, survive the world. I've had to survive everything. But survival to us is like oftentimes still moving through life with extreme emotional distress, right? It's like, yes, I go to work and I take care of my kids and I'm eating, but I'm stressed out. And that may look like, chronic neck and back pain and, panic attacks that look very functional if you're looking on the outside, but they're very debilitating for people on the inside. And so the other issue is how we screen and look for maternal stress and the stress of Black women has to be different than it is for general populations because of basically, we tend to know how to handle stress, but it doesn't mean it's not there.
Yeah, I also wonder just about the ways in which Black mothers are treated in like doctors' offices and how that plays a part in mental health implications during and after pregnancy.
Yeah, a number of the focus groups have said that Black women reported being treated, that they felt that they were treated with cultural incompetence and like insensitively. And so, and, we also know that we don't have a lot of Black providers in mental health, in comparison to white providers and others. And so when you don't see people from your community represented in the care services and you don't feel like those services are for you, for one, but also there's a hesitation to be comfortable to trust those services, especially with the historical background of racism in this nation, where those systems, including mental health, were used against us and have continued to be in a lot of ways. To punish and penalize people for needing support rather than supporting them. And so people have guardedness around that. And that makes a difference in whether or not people are going to be able to access the services if they don't feel that they're connected. And also just the general kind of incompetence of a number of providers who, approach working with Black individuals as though they're drug addicts or questioning substance abuse or questioning education or questioning, making just lots of prejudgments about who they are and their class and their the value that they come with. And it's very off-putting for a lot of folks when they want to enter care and they feel judged.
Yeah, I can imagine, because I know in mental health care, seeing that your providers are mostly white can be hard in you affirming within yourself that you even have something that needs to be treated. So yeah, I can just imagine that same kind of thing when getting care during pregnancy.
And then the risk of having your baby taken from you, which feels really strong to a lot of people, that they don't want to be honest about how they're feeling when they feel like they need more support than they have, or they feel like they're having a hard time maintaining, because people may judge that as their inability to care for their child and over refer them to child protective services and be really quick to want to question about their competency as a parent when we see, other parents allowed to parent quite well into, problematic situations because people want to preserve that family because they see those families like their family. And so, it can make a difference, that kind of implicit bias that people have sometimes against people who don't look like them. They can't relate to them in the same way, and they don't have the same levels of compassion, even if they think they do or they want to. The evidence of who gets referred and how often at hospitals for child protective services, really indicates something different.
Yeah. So, and I guess I'm wondering now, how have things progressed in terms of making services and supports more accessible to mothers, and for Black mothers specifically, have things improved in terms the way that they are treated during and after pregnancy? And yeah, again, are there communities, are there resources for Black mothers that are being put into place to help with the epidemic that's happening with Black mothers?
There are a number of organizations that have existed long term and are also coming together collectively to sort of address this together, with the strength of numbers. Black Women Birthing Justice is an organization out of Oakland, California, that did a report, as I mentioned before, the Battling Over Birth report, and it'll be a COVID-19 version, still battling over birth. It'll be called looking at Black women's experiences in the maternal system and what's needed to support them and what their stresses look like, as a way to advocate for what people are saying that they need and what they're experiencing, but also as the organization, an opportunity for people to know how to get support from those folks like midwives and doulas and lactation consultants, like maternal mental health. What does that look like within our community? Black Mamas Matter Alliance, a national organization that's a collective of Black women-led organizations, particularly in reproductive health and birth justice, has a number of efforts, really supporting those that are looking at Black maternal health. There's an organization called Shades of Blue that really focuses a lot on maternal mental health for Black women, and in particular with grief and loss. There's a podcast by a sister, Erica McAfee, called Sisters in Loss. That's really, really powerful collective of women who are Black, and this very energetically, I feel like faith-based, but you don't have to necessarily be religious to be a part of it, but it really incorporates that cultural aspect where spirituality is really important to Black folks a lot of times. And it's a place to talk about, the emotional, and psychological realities for folks that have lost babies, and to be a support to each other. There's a Black Girl Therapy that's come up with, their website and opportunities for people to know how to find Black providers. And I think in general, are people seeing a big difference? I know that they're seeing a big difference when they're working with Black women-led organizations, because I hear those stories. In the focus groups and the general sort of research, with people that are just going to mainstream hospitals, I'm hearing the same things that we were hearing in all the studies that I've ever gotten into and read, that people feel disrespected, that they're not being listened to. I know that there are efforts. I know that the system is wanting to change, or at least they're expressing that. There's a lot of efforts to do implicit bias training with all maternal health providers in California, nationally. Kamala Harris, our VP, but also was our former senator for California, was really behind efforts to have implicit bias training for providers. So that kind of stuff is rolling out, and being someone who provides a lot of those trainings, I see very willing and interested, OBs and nurses and nurse midwives that work in the hospital setting, really wanting to shift, but also feeling like the systems are so systemic that they, they're like, I can change, but what can I do about my partner next door to me? Or, some of the protocols that are not really human-centered, that don't really allow for true informed consent, because of, time constraints and the pressures to have certain things happen at certain times and to regulate people as though people's bodies birthing are on a time clock. And so I think we have, a ways to go. But I think that there are a lot of philanthropists out there that I see funding programs for community-based work, which I think is smart, because if you ask the people what's making the most difference, you're going to hear them say, my local midwife, my local doula, even local providers that are determined to really support their community, in really holistic ways. I think there's opportunity there, but also there's a gap to accessing, as we talked about from the very beginning, these support services. If you don't have the money for it, which is, sort of classically how you would pay for a lactation consultant, you would pay for a doula, you pay out of pocket for your midwife. We're looking to create systems both for insurance to cover a lot of these services, Medi-Cal and Medicaid around the nation to cover it, but also philanthropists to get behind making sure that these services can be available, especially to the most vulnerable populations with high disparities.
Yeah, it's just like you said, it seems like things are moving in the right direction, but there's still a lot of work to be done. And so for people who want to learn more, who are looking for resources, who just want to stay up to date with you and the work that you're doing, what are some ways that they can do that?
Sure. I try to keep up to date where I'm training. I do a lot of organizational and community-based trainings virtually these days. And usually the organizations are funding it. And so they're paying me, but it's free for everyone else, which I always love, because then it's like, hey, guys, you can come to this free training. And so that is on my website, drsayidauplifts.com. And it's under upcoming trainings, and there's always something going on there. I have social media, Instagram and Facebook. That's Dr. Sayida Uplifts, and LinkedIn, Dr. Sayida Peprah. The nonprofit that I work with that has a lot of community-based programming for doulas and training opportunities, like sort of more locally, is Diversity Uplifts. And, there are a lot of, individuals from diverse communities themselves that are also experts in their field that do trainings with us. And so I think it's a really great opportunity to have, like we're talking about, like the representation of, people in this work that are from our communities speaking about the needs and giving guidance and education to folks. So a bit of that is there. Yeah, I guess if people were interested in having me trained, they could contact me, and there's a way to request me as a speaker.
Great. Thank you so much for being here. I'm really excited to share this. I think we covered a lot more than I expected, so I think this will be really helpful for people. So thank you again for being here.
Well, thank you for having me. I really appreciate you holding this space.
Our next guest is Yhanni James. Yhanni is a mom of 4, model, and co-founder of the soon-to-be-open collective called Sovern, based in LA. Yhanni has worked over the years to create safe spaces for mothers to be in community with other mothers. In our discussion, Yhanni shared her 3 birthing experiences and the ways in which they affected her mental health and life in general, the struggle that comes with motherhood in America, and more. To start off our conversation, here is Yhanni talking about the nonprofit organization that she is co-founding called Sovern.
So Sovern is an intersectional radical feminist art space in West Adams. And it's here for the decolonization of wellness and healing. We support uterus-bodied humans and their allies, particularly uterus-bodied humans of color. We amplify their voices, but we're not here to say that they are the only ones with input. We really want to have experiences shared. We really want this community to be like a vulnerable space. Like I want, like if you're in a workshop and you're not crying, maybe you didn't dig deep enough. Right. Because, right? Yeah. But I think too, like, you have to have a container that feels safe enough for people to get to the point where they are ready to cry.
Right.
Or they're ready to bear it all. Or they're ready to like leave some baggage down that they've had for years and years. Or didn't even know they were carrying.
Right.
So really to me, above it all, what I truly want Sovern to show up as and to feel like is safety. I want this to be a safe space for women of color to heal. That's what I want.
Yeah.
That is what Sovern is.
Wow.
So that's what I do. This is my soul calling. And I wish that I could tell me from 10 years ago that like in 10 years you will be doing exactly what you're thinking of now. Like you will be championing for women and gathering women and celebrating them. This is in my blood. This is everything. So yeah, that's what I do.
Yeah, I was gonna ask like what called you, because you said 10 years ago you were thinking about this, so what called you to do this?
Yeah, I feel like when I had Judah, like when I had my first, it was like an awakening. It's an energetic awakening. After you give birth, it's like your chakras are activated. And particularly this chakra that links to creativity, to creation. And I felt really awakened in that way. And I wanted a community of women who were also feeling that way, who were also feeling rejuvenated, inspired, creative, ready, you know what I mean? So I looked for a community of mothers who had young children and were also pursuing their creative needs.
Yeah.
And I found them, but there was an overwhelming similarity that, like, of course, with being new mothers and also being mother artists, there is still the burden of being a woman in a patriarchal society.
Right.
So overwhelmingly, it was all, the stories were similar, whereas it was like, I want to do this, or I've been doing this, and I feel moved in this way, and I want to write it down on paper, but XYZ.
Yeah.
So I created Mama Makers Collective, which was celebrating and connecting mother artisans. And through that, realized how powerful my calling is to be in the presence of women, to be in a circle of women learning and laughing and healing is where I have felt most alive, most joy, most activated, most connected to spirit. So in following that feeling, it has led me to Sovern and why I do what I do and why it's a nonprofit.
That's so great. I feel like it takes people a lifetime to kind of figure out what they like really love.
I feel that.
Yeah.
I feel like enormously blessed to be at this point because honestly, I did not think that there was the inkling, there was like the want, like I really want to have an office with like a cute white desk chair where I go and I look cute, but I'm also like fucking it up for women.
Right.
And in my brain, it's like, how does that piece together? I don't know. And it just all came to, like, I wish I would have known, but that would have been silly. But like the way it manifested, I don't know.
Yeah.
It was none other than meant for me. You know?
Yeah. Okay, great. So we're obviously talking about your experience with motherhood, but also how that relates to your mental health. So I think I want to start with talking about, you know, your experience with your mental health and just your knowledge around mental health before motherhood. Just kind of like growing up, how was it talked about, if at all, with your family? How were you experiencing it? Did you know what mental health even was?
Wow. I mean, I've never thought of this until you're asking this right now. It feels like we never spoken about mental health. Maybe in a positive way. I think I learned about mental health regarding being like super depressed or having bipolar disorder for a family member, you know? So what I knew about it when I was younger was not the same of what I know now. That having a mental health practice is a good thing, that like it can be improved, that it can be worked on. I didn't think of it before as a verb.
Yeah, I feel like even for me, I pretty young was introduced to just the topic of mental health because I so young had to deal with my own mental illness popping up, but it was like I was the only one talking about it, so I felt the only one, and so like growing up now, I'm like realizing why I felt like I was the only one because people just didn't know.
It's crazy.
We just didn't even know to talk about this type of stuff.
Yeah. Did you feel like a trailblazer, like talking to? That's how I felt.
Yeah.
I was like, after I like went on meds, I was like to my siblings, like, come on, guys.
Yeah.
You know, because it got to a point where my therapist was just like, from what you're telling me in your history of your family and the way you normalize depression, is telling me that there may just be a chemical imbalance. Sometimes that's just what it is.
Yeah.
And from that viewpoint, it's been like, oh, like, it's easy, like, come this way, it'll be great, you know, like, come balance your brains.
Yeah.
But, yeah, I'm the only one.
I feel like I've also been like the person just teaching my family about mental health.
Yeah.
And it's hard, especially with Black people, to help people unlearn what we've been learning all of these years.
I mean, like 20, 30 years ago, it was still taboo to have a therapist, you know? So.
So shifting to when you became pregnant.
With who?
Your first pregnancy.
Okay, got it.
So even like leading up to your pregnancy and like when you got pregnant, did you start having conversations about the way being pregnant could potentially affect your mental health?
No. I had no idea that pregnancy would affect my mental health. I mean, honestly, I don't even think that I was having realistic discussions with myself about mental health until like I had the twins, maybe like a year after the twins were here. So like when I became pregnant with Judah, there was no thinking around that. Although when I was pregnant, there was so much, like it was an immediate spike, trigger, all of that immediately, but I still wasn't having those conversations. And it's interesting because thinking back, I did go to the doctor multiple times, like seeking a prescription for medicine, like, yo, I'm depressed, with my first child, severe postpartum depression. And one of my family members, when I talked to them about it, was like, maybe you don't need the pills. Maybe you just need to like walk outside more. And you know what I mean? Like try that first. So I think needless to say, my life still went on the way it was going. But I didn't go back to getting the meds.
Right.
And it wasn't until like I had a major panic attack that caused me to go seek meds again. And this time I actually got the prescription filled, but I never took them. I never took them. I think I tried it once, and at that time it was like the lowest dose. Now that I look back on it. But I think it just felt like wrong. Like I would have been a failure if I had to take that. You know what I mean? If I needed to take a pill to feel regular, then I was like totally feeling something.
Yeah.
And then when I had the twins like super woke up a lot of stuff and also probably created stuff. They are a special type of twins and their survival rate is really interesting. We didn't get like the best feedback when we were pregnant and went into the doctor. So I ended up living at the hospital for 2 months. And at that time, like Judah was 4 years old, and leading up to that moment, I was homeschooling him. We were together every day, all day, going on hikes, going to museums. Like he was we were so close, and Bobby was working like 9 to 5, and we were just a complete family unit. We had our routine. Judah had his routine, and then the twins having the diagnosis of being like mono, which means they share both sacs that surround them, when usually there's a membrane separating twins. So when the twins got that diagnosis, it was like everything was like insanity.
Yeah.
So like Judah's life quickly changed, and my life quickly changed. Of course, Bobby, my husband's life, quickly changed. And it was like a lot of doctor's appointments, a lot of like Western medicine shit that I wasn't normally exposed to. Judah was born at home. Mm-hmm. My mom's a midwife. I grew up in that world. Yeah. So we kind of, around birth, you think like birth is natural. You go to the hospital if you're high risk. It makes sense to go to the hospital if there's a problem, but birth is not a problem. So you have your baby at home. Like that's where the thinking came. So knowing that I was not only having to be at the hospital more, but going to have to live in the hospital was like, wow, this is really serious what's happening. So being exposed to that world was very like triggering. I felt like I had to be strong because the doctors were in nonstop, and I didn't want anyone to see me lose it. So that whole time I didn't lose it. I like kept it all together. Whereas my previous pregnancy with Judah, I would get anxious and I would like have a panic attack. It was out. But with the twins, I felt like the only thing I could control was my mood. So it was completely like I just took everything in. You know what I mean? Even though I'm living through the scariest time of my life. I have 2 babies growing inside me. I don't know if they're gonna die 1 second or stay alive. I'm away from my 4-year-old. I'm in an environment that I'm not used to. So it was a lot at once. The twins ended up going to the NICU, and I moved home from the hospital, but I was going back and forth to breastfeed the twins, all these things. I was recovering from the C-section, which was also very new to me, my first surgery ever. And there was no opportunity in that time to have a breakdown, Mm-hmm. So it kept on like a whirlwind, the tunnel of like life, and also of providing and giving to my children and ensuring that they're okay. So that continued to continue. Like even when they were home from the NICU, that's also not a time for you to be able to fall apart. Right. Because they come home from the NICU, and now I had 3 small children, my husband returning to work, and like there's just no time for healing in that time. So I do not distinctly remember much of the first year of the twins' life. I can't remember their first birthday. I was so deep in a hole of like the darkness. There were so many things happening. Is like everything and the lack of everything is how it felt. So then when I found out I was pregnant with my 4th, the twins were only a year old, and the whole time I was pregnant with him, there was so much fear. It manifested as like anxiety, of course, which I had been in a huge rut of anxiety after having the twins, and like thinking that they could return to the NICU at any minute, or like if they got on the ground and there was a germ, like everyone would die, or you know what I mean? So the anxiety, the depression from the twins was still there and unhealed, and then adding another pregnancy to the mix. A super surprise, but like total blessing. But it really manifested while I was pregnant with Amanu as like severe anxiety of not being able to get things done, and also needing to plan for the year after his life because I won't be emotionally available. So like, what are we gonna do while I'm in that space where I can't even fucking function. You know what I mean?
Yeah.
So thankfully, I had a moment after Yhanni was born where I just sat with him and I was like, okay, like, it's okay. Like, I was able to bring Amanu home from the hospital. I was able to just literally leave the hospital with him. And I didn't have a crazy postpartum period. Everything was pretty chill, even though I had 3 other kids. But I think that helped me realize how deep I had gone after the twins. Like, it wasn't until I got to a point where I could like take a breath is when I realized that I had been like climbing up from a ditch for a while. So the reddest flag that was like waving right before I went to get my meds, I started having dreams that I was gonna go back to the hospital, and I was looking forward to it. I was looking forward to having to live in the hospital again. Like, that would be a break. So it was like, it was time. And that's when, like, you know, yucky, unsavory thoughts are just like always a thought away or just always on replay. And my therapist at that point was like, it's time. So yeah. And once those meds hit, I was like, what? Why didn't I do this before? This is great. Like, I don't have to actively work on like showing emotion right now. I'm into this.
Yeah. I think first the last thing you said about the hospital, I want to normalize that, because I think for anyone who's spent time living in a hospital, which I've for like 2 years was spending months on and off in the hospital, and that in and of itself is like a trauma that you have to heal from.
Yeah.
Just being in the hospital, having to honestly relinquish so much control.
Totally.
But then once you're there and so much control has been taken, and you're like having other people take care of you, when you're out of the hospital, it's like, shit, look at how much stuff I was doing to be okay.
Yeah, totally.
And so I can understand how you're feeling, and I think that that's something not a lot of people talk about, but is extremely common. And I remember feeling so incredibly guilty for wanting to go back to the hospital, because it was like, why would I want to go back to a place that was traumatizing and was like, I was there when I was in the worst place in my life, so why would I want to go back there? But it makes complete sense, because it was like people were taking care of us. Yeah. So yeah, I just wanted to normalize.
Wow, that is dope. That's really crazy.
Okay, so after Amanu, when you finally got a chance to breathe, how was that? Like, once all of the movement around you settled down, what happened, first of all? Because I know that can be a lot after so much going on and then things being a little less chaotic.
So,
like, how did you manage to?
I mean, it's funny because, like, yes, everything was less chaotic, and then COVID hit. So it was really interesting during the first few months of lockdown, because the societal pressure of the postpartum period was not there. Like, even though I was taught growing up that, like, you rest after having a baby, like, sit your ass down, just feed your baby. And largely that was what I was doing. However, there were things like taking Judah to school or picking up groceries while Bobby's at, you know, things that needed to be done as a mom of 4 kids. But not being able to do errands or do all these things that I thought were absolutely necessary forced a true postpartum period on me. Forced like more naps and more reading and more laying down and more eating, just feeding myself, because gut health is brain health. And half the time I was giving hundreds, thousands of calories away to my baby through nursing him, and I was taking in nothing or whatever because I'm running around. So yeah, his postpartum period was definitely one of healing. I think it healed me completely. Yeah.
So when did you start kind of implementing like a mental health care routine?
That's so interesting that you asked that, because I feel like my mental health routine started or became like more real, the need to have a mental health routine, right after I had Judah. But it was so frustrating knowing what I needed to do to feel refreshed and to feel more positive and to feel relaxed and to feel these good emotions that I love so much. I wasn't able to do. It was me wanting to be creative. It was me as a mom wanting to sit in a circle of women and just talk and vibe and learn. It was those things that I wasn't able to get to him. So I think that too, the importance of Sovern is increasing access to those beautiful, creative, holistic healing modalities in times where usually we wouldn't have access to them.
Yeah.
So how do I break down those barriers so that perhaps another woman in her postpartum period is able to access that thing?
Yeah.
And the rest is history. Because it's like, people do not, I think for mothers in particular, I feel they're one of the most overlooked groups of people maybe ever, because it just, everything stands on their back, everything. But then there's no acknowledgement of it, or it's just so crazy. I just don't even get it. I don't even, in a fucking patriarchal society, in a consumer, like, very masculine world, it's like Americans are taught that, you know, the man is the head of the household. But these days, men are still viewed as the head of the household, but women are working and providing for their children and doing XYZ and doing his laundry. Something's gotta switch. This is not sustainable.
Yeah. It just doesn't make sense. It seems like common sense that we would be cherishing the people who bring life into the world
Right?
the most. And what I've learned from all of these conversations I've been having and just talking to friends and family is like the dichotomy of motherhood and going through the birthing experience is that it's like one of the most precious experiences, but it's like you were saying, mothers are treated like shit in America.
Like, we have to change. We have to change. I hope that this is a step in the direction of change. Because, oh my gosh, it's not even just us, like, as women, it's us representing the future.
I think something that's important is something I've also learned from talking to young mothers recently is how much it's important to continue to be their own person and also be a mother. And not kind of sacrifice everything just because you have kids. And that's something that I've witnessed my mom do. And like just completely throw away her entire self to show up for me and my brother. And I think that's something that's like also a crucial conversation when talking about mothers in the US, is talking about how it's so important for them to continue to take as much care of themselves as they are their children, because their well-being is their children's well-being.
Totally.
And so that's why I think conversations about motherhood and mental health are really important, because it's so connected.
It is so connected. Oh my gosh, that connection that you just made was so profound. And again, why I feel like people need to be having more conversations on mental health. Because something that I'm living or have lived is also your lived experience with your mom, and prioritizing you and your brother over her needs, because it's been what she's conditioned to believe is the right thing to do. And it's interesting even looking at, like, you know, if I were to get a modeling job and it caused me to travel, like, the societal conditioning will say, oh, like, you're a bad mom, why aren't you home with your kids, and all these things. And it's very interesting. So the only way we can change this for the future is normalizing it for ourselves, huh?
Because I think you recently went to Mexico, right?
And I went, and then I went again, girl.
And like, that made me so happy to see you doing that, because it's like, she's like taking time away from her kids, and the fact that you were like taking time for yourself and also like sharing that you were doing that was just made me so happy. And it was like, I can imagine a mom seeing that and being like, wow, I'm allowed to like,
I love that. That's all I would ever hope. And the woman who, her on Instagram, she's my spiritual mermaid, but her name is Elizabeth, and she's a clear audio, and she told me that my ancestors are saying that it's time for me to step into the light a bit more and show more of my personal life, because what I share will help other women. And you bringing up my trips to Mexico, it, like, if that is all it does, I'm into it. Because also having experiences like going out of the country without my kids was so much of like a homecoming for me. Because the last time I went on a plane was 10 years ago when I found out I was pregnant with my first. And so to go to Mexico, to go to Guerrero without kids, just after my 30th birthday, after the past decade of my life had been devoted to my family and children, was very profound. It was definitely like a come to self moment. And then being affirmed and able to go back after a couple months was so profound. Again, like so huge in my life. Because I also, this last time, a couple weeks ago when I was in Guerrero, I knew that it was on the eve of opening this space. So I think from the first Mexico trip, there was so much growth between those trips, and it was only in a couple months. And the growth came from me doing some serious like self-reflection. And it's interesting because when I went back home to my kids and my husband and my life and my responsibilities, I am more able to walk in my full truth with those things. Because I'm more self-actualized, I'm more knowledgeable of what that truth is, of what I want to omit, of the emotions that I want to have. You know what I mean? Like I understand better myself after doing things for myself. But I'm grateful for that place. I think it's absolute magic. Absolute magic. Maybe every mom needs to go on a solo trip. I know that there I connected to my roots. For sure. Like that connection to that climate was like, it was like a sacred lineage feeling. Like, you know what I mean? Like, oh yeah, this is the temperature that my body is most comfortable in. This is where, okay, got it. I feel at home, you know?
So after going through all that you went through with all your pregnancies and realizing the importance of having a mental health practice, what does the way you take care of your mental health look like right now?
Oh my gosh, it's funny because even as you were asking that question, I was like, mental health practice? Like, wait, what the fuck is that?
I was thinking that when I asked the question just before this, I was like, I don't even feel like I have like a cohesive mental health practice. I still feel like I'm like trying to figure this shit out. So like maybe not practice, but even just like,
I feel like mine is like a mental health awareness. Because there's more checking in that I have to do with myself, more conscious pauses and check-ins that I have to do. More like connection to my intuition that I have to do. And actually, now that I'm talking about it, I'm realizing that when I'm out of connection of those things is when I feel most anxious or depressed or just yucky in general. Things like eating, you know what I mean, taking my vitamins, all those things are really dope and they do nourish me, but I feel like those things are just as important as me like talking to human beings, like me being around particularly other women, like fucking goddesses dancing around a fire, burning sage, and like hugging each other, you know what I mean? Just like being in the energy, laughing, talking, sharing, being in joyful space in conversation is a huge mental practice, mental health awareness practice for me. And I want to do a better job of honoring it as such. I don't want to be like, oh, I'm going to dinner. Like, you know what I mean?
Yeah.
Like, it's not a bad thing to go out with your friends, even if you're made to feel that way because you're a mother or because you are married. And I want to do a better job of celebrating that me going out with friends is part of a positive practice for my mental health through and through.
Yeah. And just acknowledging that everyone's mental health practice or just the way they take care of their mental health looks different.
It looks so different.
Yeah.
That's so interesting because I'm the oldest of 6. My husband was raised as the only child, and his mental health shit, like, he feels so refreshed after, like, spending a weekend alone. That would be my worst nightmare. Like, please do not, like, I think after a weekend alone, that would be absolutely awful. I'd probably come back in a bad way. Like, that's not for me. So it's almost like that has evolved our love language, like recognition of each other's ways that we like refill.
Yeah.
And also not judging it. You know what I mean? Because before it was like, why do you want to be alone? Like, don't you want to be with me? Like, you know?
Yeah.
But now it's like, oh, I get it. Like, I'll see you later.
Yeah. Okay, so you do some modeling.
Yeah.
And in your modeling work, you get to work with your kids sometimes.
Yeah.
What is that like?
It's fantastic. I love it. I'm still pinching myself that we've been able to have such a successful career in such a short amount of time and work with the brands that we have. I never, ever in my wildest dreams imagined this happening, but it's so special to have the kids with their mom and dad on set. Like, I think it's special too for all of the people who we encounter who have never met kids like them, who have never met kids that are able to advocate for their body as clearly as they are, as young as they are. My youngest son, Amanu, we were on set 2 days ago, and the tailor was trying to touch the clothes on his body to tailor them. And he was like, no. Like, he does not want to be touched right now. He does not know you. He does not want to be touched. But it's interesting when you're with adults who are not used to talking to kids who are like, don't touch my body. Or they're not used to talking to a parent that says, you can talk to my kids about what you want to do to them. Like, you know, hair people, COVID testers, all these people coming up to me saying, I'm going to do this to her. And I tell that to her, and I'm here. You know what I mean? So that has been really, really special. And also with the lockdown, we were still able to be together as a family and work on small sets and things like that and build our career. So I'm grateful for that time and grateful that a lot of kids were, you know, just completely stuck at home, but we were still on set and doing stuff and traveling because of it. So I'm really grateful for that time. Yeah, modeling is fun. It's fun and hard though. It's so much work. I'm really grateful that like this industry is what you make it. And like if something is not working, you're told that like people just keep working you and you know, get fucked over. But I'm not interested in getting fucked over. And I have kids, I'm not interested in them getting fucked over. So I'm walking into this industry with a sound awareness of who I am and why I'm here. And if you're not down with that, then we're not working together. I've been under contract before, and we're there, and the producer was unorganized and wanting us to take one of our kids off set, to bring somebody else here to take them off set and all that. Like, this is too much. So I went to the producer and I was like, dude, I have a job here to do. Tell me what else you need and then I'm leaving. This is the most unprofessional thing ever. You guys get to go home after this. That's done. Your job was done. I get to go home with my kids, and if this traumatized them from being taken away in the middle of the day with people they don't know, I'm living with this. Right. They're living with this. So I'm not down with it. And it turned out we only needed like 30 minutes more shit, and we were all able to leave at the same time. It's just like, this industry and life can be so beautiful if we were all just taught to like walk in our purpose. Yeah.
Awesome. Okay, so lastly, if you want to plug some places that people can follow you to stay up to date with any of the work you're doing, and when Sovern's going to be up and
oh my gosh, yes. Sovern is Instagram at Sovern, SOVERN.LA. And me on Instagram, I'm Mama Yhanni, Mama period, YHANNI. And Sovern is gonna start opening soft programming stuff in like October. Probably around the full moon because we're witchy bitches. And I'm really excited just to like particularly do more work around celebrating menstruation, just talking about menstruation and doing womb wisdom in the space. And I'm excited to do some classes that have to do with radicalizing your doula work if you're a doula. I'm excited to have this really dope artist, Antonina, who is the most anti-racist white person and creator, living in the space and doing a mural in the space. I'm just excited also for like this next generation, honestly. Like, dude, I saw this kid who was probably like in middle school. He had on like regular like tennis shoes, shirt, jacket, and just, he also was wearing dangle earrings. And I was like, whoa, like, wow. Yeah. Wow, the kids are all right. Like, I'm so excited for this next generation.
Thank you so much for listening to this episode of Students of Mind. In having these two discussions and doing research for this episode, I discovered just how inadequately and honestly disgustingly mothers are treated in the US. Because of this, I'm going to leave some extra resources below for more information about the services that are out there helping and uplifting mothers, and information just about the state of maternal mental health in the United States in general. I want to say a huge thank you to Dr. Sayida for coming on the episode with so much insight and information, and Yhanni for being so open and vulnerable in sharing her journey. If you want to follow them or see their work, all of their links are listed in the description of this episode. As always, if you want to follow myself and the rest of the Students of Mind team, our social media links are in the description as well. If you have time, please leave a rating and a review for the show. It helps get all of the information and stories shared on Students of Mind into more ears. Thank you again for listening. I hope you learned something new, and I'll see you next time.